So we are now, well, I'm excited to welcome our next speaker, who is up nice and early, joining us all the way from Plymouth in Devon in the UK, Dr. Rebecca Baines. We'll just wait for Becky to come online. She won't be too long. I know she's there. We can see her in the green room. And here she is now. Hello, Becky. How are you?
Very well, thank you. Thank you very much for having me.
Yeah, it's wonderful, Becky. I'm just going to say a bit about you, Beck, if that's all right. She's a research fellow at the University of Plymouth, and she has undertaken a series of research projects around online feedback, the impact of patient feedback and comparisons between online feedback and validated surveys. So today, Becky is going to be sharing a 10-minute presentation with us based on her research findings, which look at the value, meaning, and impact of online patient feedback. Thanks, Becky.
No problem at all. Thank you. So I'll just start sharing my screen. Fantastic. Thank you. Brilliant. So hopefully that's just loading now. Brilliant. Fantastic. So thank you very much for having me. It's really, really appreciated. So obviously talking about patient feedback and the value and impact of that. So here's my slide. It won't move. Brilliant. So in terms of the background to online feedback, then patient feedback, as you were just discussing, really, it was a fascinating session, is considered integral to patient safety, quality improvement, and professional development. The use of online feedback, particularly in the last year, is increasing on an international scale. And evidence suggests, following a recent systematic review, that patient feedback is more likely to be influential if it is specific, collected through credible methods, and contains narrative, comments, or information. So what do we know about online feedback so far then? As again, you were talking in the panel earlier today, contrary to popular belief, online feedback is mostly positive in nature. Content shared in online feedback can help identify high risk or underperforming organisations, and online feedback is particularly helpful in achieving this in a quicker time frame than perhaps slower and often paper-based methods. One of the leading motivations for people sharing online feedback is to actually give praise, and a recent paper suggests that this is the idea of caring for care. So again, contrasting to some hesitancies around why people may be sharing their experiences online, it's often for a much more sort of altruistic reason and motivation. What affects online feedback use and engagement is often healthcare professional attitudes, particularly around anonymity, as you were talking then. For healthcare professionals, this can make it difficult or uncomfortable and potentially challenging to address, but often it's understanding that it's the wider learning points and opportunities for change for that one experience as opposed to that one individual. Confidentiality is also an area that healthcare professionals can feel uncomfortable around, in that they may be breaching confidentiality or able to identify an individual patient if they have a specific healthcare condition, for example, or experience that makes it very easy to identify someone. Similarly, following other kind of discourses and arguments and feedback, generally not just online, concerns around representativeness are also raised by healthcare professionals. Perhaps of particular importance, particularly in an online context, is concerns around moderations or regulation of online feedback. We've recently conducted a evaluation of a hospital trust in Cornwall, so in England, that was placed into special measures. And actually that the moderation and confidence in the moderation process used by Care Opinion was one of the facilitating factors for them adopting online feedback. And now I think second in the league in terms of number of responses and changes made, which is fantastic. There can also sometimes be differences between the attitudes and experiences of healthcare professionals. So nurses typically see online feedback as more useful than doctors. Similarly, doctors are also more likely to believe that online feedback is unrepresentative and generally negative in tone. Other factors known to influence feedback use and engagement include awareness of opportunity. So many patients don't know or aren't aware that they have the opportunity to share their feedback online, and this can often cause frustration or resulting in patients sharing their experiences in an inappropriate and ineffective system. So, for example, a lot of critical experiences will end up through the complaint system when patients don't necessarily want to make a complaint, or it's not considered a complaint and therefore gets removed from that system. Staff anxiety, I think, again, as you were talking in that panel session just before I joined, is typically around time pressures. So do I have enough time to respond to feedback? An argument, flipping that argument on its head, is do you have time to not respond to feedback and allow things to escalate? What's the costs of doing that, both in terms of organisational reputation, but also service improvement and quality? Particularly in response to online feedback and care opinion more broadly, some concerns are around the variability and lack of confidence in responding to online feedback. Because of the public nature, it can be quite uncomfortable for people to respond. But there's a number of research now that's explored this. So, for example, Laura Ramsey's work has identified different categories or different types of feedback responses. Our research in mental health has also identified a co-produced response framework that takes people through how to respond in a meaningful and effective way from a patient perspective. And there's a link to that at the end of the presentation. Reported benefits of online feedback from a patient perspective include the use of narrative or free text comments. And this is, I can't stress the kind of importance of that enough from a patient perspective, because it allows patients to describe their experiences in their own words as opposed to the words that have been decided for them. There's also contrasting against healthcare professionals' concerns, assurances of anonymity from a patient perspective, and this can lead to increased or enhanced authenticity of feedback provided. Online feedback is also typically perceived as easier to use from a patient perspective, although of course not all. Domains of care that matter most, again, tapping back into that narrative comments. So we explored, as Michael was saying earlier, what people share on online feedback in mental health and what they are currently asked in validated questionnaires for a process called revalidation. And what we found is that patients describe different domains of care than those used in the validated questionnaires, and often use different language and terminology to describe those experiences. There is often a disjoint between the questions that are asked of patients and the areas of care or questions that they consider of most important to them. Again, linking back to that kind of openness of digital feedback, another benefit from a patient perspective that we found is the increased transparency and perceived importance of online feedback, because if it is publicly available, patients then feel that the organisation is more open to patient experiences and takes it more important than perhaps internal methods and processes, which are typically removed and not public facing. So that can enhance kind of public inferences of trust, but also accountability and transparency, which are important aspects to consider. From a staff perspective, interestingly, a recent evaluation in that special measures organisation, which some would argue is perhaps the worst time to engage with online feedback, actually found that working with online feedback increased staff morale, resilience, and pride. Some healthcare professionals also actually really appreciate the ability to publicly respond and demonstrate change. Again, it just helps to increase those relationships between patients and the public and the organisation working with online feedback. The provision of in-depth narrative experiences can elicit greater insights and also enable kind of more contextual information to be provided than perhaps through other, often paper-based methods. Again, a perception that the feedback received is more authentic because people feel able and more comfortable sharing their experiences. From a kind of information or knowledge exchange perspective, staff also talk about the ability and ease of which they can share feedback in near real time. So, for example, in the UK, we have the Friends and Family Test that's conducted once a year. This can often mean that changes made can be delayed for up to a year because people are not aware of the challenges or difficulties, or indeed areas of best practice that can be celebrated. Linked to that is, of course, the reporting and evidence opportunities afforded by online feedback that, again, are perhaps more accessible in comparison to traditional methods of feedback. So how many benefits are there to patient feedback? I think there are many, and across an organisational and individual level as well. So a recent implementation evaluation that we conducted of care opinions specifically identified 24 benefits, which was fantastic. And one quote that we particularly like is from a clinical manager who reads that, "I really love it, online feedback, because for me, working in the emergency department, you see a lot of terrible things happen. You see a lot of really sick patients, a lot of illness, and really poorly patients. The staff have to, on a daily basis, see things that you wouldn't want anyone to see. So for me, it's such a refreshing change because we predominantly get positive responses and feedback. It's just so nice to be able to cling on to that and share the feedback to the staff, those really nice positive things. It helps improve morale. It helps people's resilience to know that there are actually some really grateful people out there. And you know what? You are doing a good job. And sometimes you just need that little bit of a reminder. When I see comments like that, that helps me deal with the everyday situation. Generally, it makes me feel appreciated in what is a really hard, difficult working environment. It's morale boosting. For me personally, it's that little glimmer of hope that you hold on to amongst a multitude of horrible things. And then in terms of rapidly adopting online feedback, we've developed, based on that implementation evaluation, a model for ways to rapidly adopt online feedback in an organisation. And this is called the Engage, Support, Promote model. And there's a link again to the paper there that may be of interest. So in summary, the research that we've conducted so far demonstrates that online feedback can help address them by allowing patients and the public to share aspects of experience that matter most to them and not those that have been decided for them. Online feedback can help increase transparency, feedback authenticity, and responsiveness. Online feedback can also help to identify high-risk organisations, poor practice, and areas of concern, often much quicker than perhaps more archaic or slower paper-based forms. But also, perhaps most importantly, online feedback can also help to identify areas of best practice, enhance staff morale, resilience, and pride. Thank you.
Oh, Becky, that was, I'm always in awe of the great research you're doing down there at University of Plymouth around public online feedback. It is really fantastic. My only regret is that you can't get to Australia and we can't get to England at the moment, which you know, we love sharing that learning. And in Australia, we would welcome researchers, academics, like you, to engage in this research. We've heard from our panel members about, you know, it's emergent. I mean, you know, we've been going 10 years in Australia, but there are some champions. And, you know, we heard Adam Lilly was referred to before, one of our first uptakers of the platform in Melbourne. So wonderful, Beck. What we'll do is people are asking questions, so we'll be in touch with some. We'll be in touch with some of those responses because we're going to get back in touch with everybody post event. But thank you so much for getting up early. And I hope the summer is a better one this year for you guys in England. Thanks very much, Becky. Cheers.
No worries. Thank you.
Okay. Bye-bye.
Bye.